and I'm not one to use incendiary or exaggerated language in any way. This virus is out of control in Houston.
Local leaders sounding the alarm today about the spread of COVID-19 in our communities as the governor starts to roll back the statewide reopening. Harris County Judge Lina Hidalgo has raised the COVID threat to its highest level, but she can't legally enforce her stay-at-home advisory.
The two top states with the largest increase in test positives are Texas and Arizona.
The Woodland, Sugar Land, Houston, and Harris County are all on the White House's watch list today. The Vice President and Dr. Birx are headed to Texas this weekend to meet with community leaders. Hi, everybody. Welcome to the 411. I'm Russ Lewis. From the White House to Houston's mayor, all levels of government today talking about the rising number of COVID cases here. And Reka, you're explaining Harris County judge's plan to control that surge.
Yeah, Harris County is now at its highest threat level for COVID-19. Judge Lina Hidalgo raised it today because of worsening spread and strained testing capacity. She's asking us to stay home, and she wants us to know why. Adam Bennett shows us.
Reka, Judge Hidalgo says people should do the same things they were doing back in March and April when the county first issued its stay home, work safe order. But she says the situation now is far worse.
If we do not act now, we will be at the point of no return.
Harris County Judge Lina Hidalgo said she's acting by raising the county's COVID-19 threat level to red level 1. That means you should minimize contact with others whenever possible and avoid leaving home except for essential needs. That includes things like groceries, gas, medicine, essential work, or outdoor exercise.
I cannot stress enough the severity of this situation.
Even though today's message is the same as the one in March, Judge Hidalgo says this time around she's issuing an advisory, not an order. Governor Abbott's order limits what cities and counties can enforce.
As the governor makes more tools available, you better believe we will take advantage of every single one of them. But at this point, I'm asking the community to go well beyond that.
Judge Hidalgo says the data shows states where people stayed home longer did better.
They also had protests there. They also had Memorial Day there. And yet, look at where we are.
And Judge Hidalgo says the county's medical shelter of last resort at Energy is on standby and ready to be activated within 2 to 3 days. But she says they'll only do that if hospitals are converting regular beds to ICU beds and are at risk of running out. Russ?
Adam, thank you. Houston's mayor says our infection rate today is 3 times what it was 3 months ago. He also said organizers have canceled this weekend's Pride activities.
They made the decision on their own not to proceed with the march and the rally.
That event typically draws hundreds of thousands of people to the city. Fire Chief Pena, he said COVID has taken 200 of his firefighters out of service. The mayor's joining the Harris County judge. Both will post photos and names of those businesses violating COVID-19 guidelines. They're calling it a wall of shame. The Harris County advisory, basically a recommendation for your health and safety, but the governor's orders are enforceable by law. Texas is once again tightening its restrictions on bars and restaurants. Under Governor Abbott's new order, all bars now must be closed to in-person service. Restaurants will also have to roll back to 50% capacity. That starts on Monday. The Texas Restaurant Association says with 30% of the state's restaurants projected to close this year, the governor's decision to limit capacity to half, it's better than nothing.
So if you were to go back to 0%, it would definitely be catastrophic, and we don't want to get there.
The Restaurant Association predicts many businesses will not survive this second wave of restrictions. The White House is concerned about the spiking number of cases in Texas. Dr. Birx and Vice President Pence will visit the state on Sunday to see the response in our communities.
In the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom.
In the last 2.5 weeks, the number of positive test results has jumped to 17% in Texas. That's according to the White House. That's a higher number than the state is reporting, and we're working right now to figure out the source of that discrepancy. Dr. Birx made it clear while the situation is serious in the southern U.S., it is not on the same level as the spring surge we saw in New York. President Trump's challenger Joe Biden says if he were president, he would use executive powers to make face masks mandatory in public. Starting Sunday, Pearland is requiring masks in businesses for both workers and customers older than 10 when social distancing is not possible. The city of Galveston is extending its mask order until September 30th. You can see a full list of those orders by location right now on our website at khou.com.
Developing right now, state lawmakers in Louisiana are considering shutting down the border with Texas to contain the COVID-19 outbreak. You may recall Governor Abbott had ordered a 14-day quarantine for travelers from Louisiana when our neighbors to the east were dealing with their own COVID spike in the spring. This is just a proposal right now. It's not official, but we will stay on top of this developing story. The state's COVID-19 positivity rate is what has public health officials worried. That's the ratio of positive cases to the number of tests conducted, which exceeded 11% this week in Texas. That's nearly double the ideal level. Jason Miles shows us how to get tested.
This COVID-19 testing site at a football stadium reached capacity by mid-morning. But dozens of other testing sites continue to try and meet demand, something expected to increase amid a higher level of urgency. Right now, there are more than 80 places to get tested across Harris County. That's according to this interactive map on the Public Health Department's website. Some that require appointments, while others do not. And that's not including individual doctors' offices or clinics also doing testing. Director Umair Shah says that everyone should get tested if possible to truly gauge the spread, although those experiencing symptoms should come first.
Now, obviously, if somebody has symptoms, that's the highest priority. If somebody doesn't have symptoms, but they feel they've been exposed to somebody or they've been out and about, that's then the next priority.
Some federally supported testing capabilities set to expire at the end of June have been extended, which means that a greater number of tests may be conducted. However, turnaround continues to be an issue for more accurate test kits, and anyone suspected of being positive or experiencing symptoms should still self-quarantine while awaiting results. Back to you.